This is Grace with Graceful Living. Today we have our second episode with Dr. Terrence Young, DDS, about preventing cavities.
What kind of foods cause cavities? Is it sugar?
Cavities begin with the demineralization of your enamel. And when the person does not brush well enough, or there's an accumulation of the plaque bacteria, which also contains the bacteria that can cause tooth decay, if it's left undisturbed, it will slowly demineralize the enamel, and then a bacterial infection will eat away the tooth structure. So you've got to be very careful with acidic foods, because acidic foods can automatically start the demineralization process, which makes it even easier for the bacteria to get set up for cavities.
So what do you do if you like eating acidic foods?
I've been practicing for 25 years now, and I've noticed a significant amount of acid erosion in our patients over the last maybe five years especially. There seem to be a lot more foods with acids in them, and people don't realize that they are actually acidic. A lot of these energy drinks, patients who are in their 20s who take one or two energy drinks, all of a sudden they're realizing that they're getting a higher incidence of cavities, but also their enamel is getting erosion, and so permanently destroying the enamel. Acidic meaning not just energy drinks, but jamba juice, fruit juices. Here in Hawaii we have so many tropical fruits, all high in acid content.
Can they rinse their mouth with water afterward? Is that helpful?
It's helpful to rinse, definitely.
And how long should you wait to brush your teeth after having an acidic drink or food?
When you drink something acidic, there's a period of time where your enamel is actually in a softened state. And in your body, naturally occurring in your saliva, there's minerals which help to remineralize your tooth. It takes several hours to remineralize, depending upon how strong the acid is. So if someone were to drink something very acidic and rinse their mouth and say, well, I better brush my teeth, they could actually be damaging their enamel. Depending on the type of acid, probably safe to say a couple hours. I've had instances where people changed jobs and they were working late at night now. So they would go home and have a glass of wine every evening, and then brush their teeth and go to sleep. And when we saw them 6 months to a year later, we noticed significant enamel loss. Probably do not have acidic drinks right before you go to sleep, because you need some time for the remineralization process to occur.
What is the pH at which damage starts occurring to your teeth?
pH is at about 5.5. And for your reference, carrot sticks are 5.5 pH.
What else is 5.5?
5.5
or
puts
less?
us in the range of natural cheeses. Bananas are 5.1. Yogurts are in the 4.2 range.
Which toothpaste do you recommend?
I recommend Pronamel by the makers of Sensodyne. But Pronamel seems to be a well-researched. The abrasivity level is lower than most other toothpastes.
Just to clear things up for our viewer audience, are you sponsored by Pronamel?
No, I'm not sponsored by Pronamel.
Thank you, Dr. Terrence Young. If you like this video, please give me a thumbs up and subscribe. Please go to graceinhawaii.com for more information.
So should we get a pH stick and test all our drinks then?
I think so, yeah. Yeah.